Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
Welcome to Sports Doctor. My name is Joe Chapana. Sports Doctor tonight brought to you by Cross Keys Physical Therapy Sports Medicine Center. They're in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. Offering free screenings. We'll give you numbers to take advantage of that offer. All you have to do is call, schedule an appointment, and you're in. Tonight we're going to be talking knee injuries, so if you want to call us about knee problems you're having, maybe some questions you have, our toll-free number is 1-888-634-7488, and that'll get you through to us here at Sports Doctor. Answering your calls tonight, we have Dr. Anthony Valarie. He is a board-certified orthopedic surgeon. He is with Tri-County Orthopedics. Their number, 589-7770. I got carried away reading the screen. You wanted to say hi to your kids?
Yeah, hi Daniel, hi Sarah.
Big night trick-or-treating yesterday?
Too much. They're all tired. They're going to go right to bed after this.
I think you got your marching orders there. Next to Dr. Valarie, we have Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. And you have an anniversary.
Sure. 3 years today, shaving my hair off, right?
It was a Halloween costume,
That's right, a Halloween costume.
It's looked great ever since.
That's right.
Anyway, our toll-free number is 1-888-634-7488. Knee injuries is our topic tonight. Why don't we start out with the anatomy of the knee joint, Dave?
Sure. This is the right knee. You start with the bones first. This is the femur. This is the tibia. This is the fibula. This is the patella. All right, and then the superior patella tendon. Inferior patella tendon. This is the lateral collateral ligament. Turn it here. This is the medial collateral ligament. And then let's go inside the knee where everything seems to be happening here. This is the medial meniscus. This is the lateral meniscus. This is the anterior cruciate ligament, or ACL. And we'll turn it around. This is the posterior cruciate ligament, or PCL. And that's the basic anatomy.
And while we're waiting for your calls on knee injuries at 1-888-634-7488, let's talk about that ACL, Dr. Valarie. We constantly hear of athletes tearing that. In fact, there was this guy, Donovan McNabb, I think his name was, who tore it last year. Still questionable whether or not. What is this ACL? Why is it so important?
Well, there's two main stabilizers of your knee joint. And more importantly, it's the shin bone, or the tibia, below the knee joint. Every time we walk up and down stairs, every time we get up from a seated position, our knee, if we didn't have those ligaments, that lower bone would sort of shift forward and shift back. It's the anterior as well as the posterior cruciate ligament to help prevent that bone from doing that and help to prevent that shearing across the knee joint. The ACL keeps the tibia and the shin bone from shifting forward. So when you're in a rutting, like McNabb, you're in a rutting, cutting, pivoting type sport, soccer, rugby, anything like that, you need that ligament or else your knee is going to be very unstable. And just because it's unstable doesn't mean that it needs to be painful. But when it's unstable and you're participating in sports like that, now you're introducing a whole line of other kind of injuries to the knee.
Such as?
You could be introducing meniscus tears, premature wear and tear of the cartilage in the knee, not to mention injury to the other ligaments around the knee, the collateral ligaments, the PCL, and you're putting more stress on the surrounding muscle and tendons of the knee, and you're making them work harder.
Okay, and Dave, we've already talked about football, but what are some other activities or sports where people may be vulnerable to
Really,
these
any
injuries?
sport or activity where the foot is in a planted position and cutting is involved, as the doctor nicely explained, as in football, soccer, rugby, baseball, tennis, anything like, once again, if the foot is planted and cutting is involved, you're putting that ACL at jeopardy.
The most recent ACL injury that I can recall was the guy that was arguing the call for the, I think it was the Padres. And I mean, there was no contact whatsoever. And here the ACL went on. It's a very serious injury. His whole season ended. Now let's talk about treatment options for the ACL. The surgical treatments, Dr. Valarie.
Well, the surgical treatments will be an arthroscopic reconstruction of the ligament. letting it sit and rest and heal doesn't work. The ligament is not going to come back and be functional again. You need to have the surgery. If you want to stabilize the knee joint, you have to have a new graft, whether it's your own patellar tendon or hamstring tendons or whether it's a cadaver. That graft needs to be passed along through the center of the knee, along the track where that original ACL goes. You secure it in place, and then you're off the races with rehab after that.
Now, you mentioned some of the options for grafts, the organ donor, I guess, and the hamstring. What are the advantages and disadvantages of each?
Well, the advantage, I guess, of one, we can either take your own patellar tendon or your hamstring. If I were to take one, I'd take the hamstring. It's really surgeon preference. There's no one better than the other. There's articles that come out all the time that talk about knee pain with patellar tendons, and that's why you should do hamstrings, but it's really kind of equivocal. But more and more I do donor grafts, which is basically a cadaver, and they have the same tensile strength, almost as equal as the graft I would get from the patient, and it not only quickens the time up for surgery, but also I think it helps them, at least in the early stages, along with rehab.
All right, our toll-free number is 1-888-634-7488. We're talking knee injuries tonight, so if you want to give us a call about your knee, you can reach us at 1-888-634-7488. Let's go to the phones and talk to Pat in Holland, Pennsylvania. Pat, you're on Sports Doctor. What's your question for us tonight?
How you doing, Sam? I'm actually Sandy's husband, Sandy United.
Okay.
And my question is, I had meniscus tear surgery last year, and I'm 54 years old, and my chiropractor said that if I continue to run, I run like 15 miles a week, that I'll be heading for a knee replacement by the time I'm in my 60s. Now, I lift weights. I take care of my body real well. I'm only 160 pounds at 5'11". You know, what's your opinion on that?
What about this whole running thing?
Running's okay. I think it's more cardiovascular than anything. But it's not so much the meniscus tear. It's the arthritis that maybe surrounded the meniscus tear. Let's assume for a second that your knee was pristine and perfect except for that meniscus tear. They take out the meniscus, the torn part, they leave whatever good meniscus is there, and then you keep running like you're running. On the whole, I don't think that's a bad idea. I forget how old did he say he was?
54.
Oh, he's 54. So if that's the scenario and your knee's fine and you run like that, I don't know. I think at 54, if your knee looks that good, I'd say go ahead and keep on running. It might wear out by the time you're 110. But also you got to factor, by the time you're 70 or 80 years old, you're probably not going to be running like 15 miles and all that stuff. But if you have some wear and tear already starting on the surface cartilage, not the meniscus, but the surface cartilage, then yeah, it's just like wearing the tread off a tire. The more you drive your car, the faster it's going to wear out. Now, if you want to do something besides running that's going to help your knee, I'll tell you the number one thing I think, and I could pitch it over to Dave here and see what he thinks. Number one thing, bar none, is swimming. Swimming, you get a great cardiovascular workout. It's like almost no impact on the joints, but you are virtually working every joint and every muscle in your body. Other than that, we're talking cross-country, like Norditrack, or other than that, like biking. And then comes like running and stuff, because you're pounding the pavement every time, and that takes a toll on your knee.
Dave, you're shaking your head about aquatic therapy.
Totally agree with him. Totally agree with him. Because you're getting into the water, you're decompressing the knee joint altogether, and you're able to get in there and really work the heart. And that's really what it's all about. You want to get into it. Unless you absolutely love to run, and if you love to run,
right,
you worry about the situation, the pounding, because you're hitting the concrete. You want to do that, and you can do cross-training, like the doctor was talking about. You can do EFX. You can do the treadmill, even where you have a little more of a cushion on the track, which is going to take it easier on the knee. If you just love to run, you can do that. It's better than running on the concrete.
Yeah.
Things like that. So, but the best of all is obviously getting into the water, and you can do running right in the water. It's absolutely tremendous, and you'll be so amazed how quickly your heart rate gets up.
And if you are going to run, it's better to run on, like he said, an absorbent surface. Treadmill, if you run, you can run on grass if you know the surface area. Running on a street or a sidewalk is the worst thing unless you have good shoes with a good absorbent heel. or if you're going to run, like I said, run around a track that's made of crushed rubber.
All right, Pat, good advice for you. Thank you for the phone call. Our toll-free number is 1-888-634-7488. It's Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Knee injuries. Let's talk to Tom in Coatesville. Tom, welcome to Sports Doctor. What's your question for us tonight?
Hi, thanks for taking my call. I'm going to be training for the New York City Marathon next November, and I wanted to know if there's anything out there to prevent knee injury. I see some people wearing the straps that go across the top of the knee, or if there's some sort of not a brace, but some sort of a support that I can use to prevent an injury. I have good knees now, and I want to keep it that way.
Okay. Well, adding support, lessen his risk, or does it matter?
What do you say, New York Marathon?
New York Marathon.
I think probably the best thing is don't run the marathon. But if you're going to run it, see, braces, when you talk about a brace, lots of the braces, at least that I deal with, are designed for a specific purpose, to either protect the collateral ligaments, or to protect the ACL, or to unload a certain part that's arthritic. Other than that, you're talking about a general kind of knee brace. Neoprene, maybe with a patellar cutout, something like that. I think probably short of that, I don't know how you can decrease the risk of that. And I think probably the best thing is, nobody just sort of goes out and wakes up one day and says they're going to run the marathon. You train for it. You condition for it. You got to make sure that everything from your quad and your upper leg to your lower leg, you got to make sure all the muscles around that knee are in great shape. That's going to be your best defense against an injury to the knee.
All right, Tom, thank you for the phone call. I understand we have Wes on the line who's visiting Philadelphia from Iowa. And Wes, if you hang on the line, we'd like to talk to you. We need to take a short break, though. It's Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Look at their locations: Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, Swedesboro. There are the numbers. If you'd like to take advantage of the free screening offer, call the center nearest you. Make an appointment. It's that simple. Stay with us. We're talking knee injuries, and we'll take your phone calls right after this short break here on Sports Doctor.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
Welcome back. It is Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center, Sicklerville, Woodbury, Washington Township, Vineland, Pennsville, Swedesboro, offering free screenings. We'll give you the numbers in just a second to take advantage of that offer. You can reach us toll-free with your questions about knee injuries. It's 1-888-634-7488. Manning the phones tonight, Dr. Anthony Valarie. He is a board-certified orthopedic surgeon. He's with Tri-County Orthopedics. Next to him, Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. Our toll-free number again, 1-888-634-7488. Wes from Iowa, who is visiting here in Philadelphia. If you're still on the line, go right ahead with your question, Wes.
Hey, thank you for taking my call. And I'm actually a native Philadelphian. I just happen to live in Iowa now, and I flew back to speak at Cheney University. I have had my cartilage in my left knee removed and had several surgeries, obviously, to clean out the calcium deposit. I'm still relatively active now. I'm a former Temple gymnast. I've actually flew to Colorado one time and had Dr. Richard Stedman remove it. My question is two-part. Am I still a candidate without having cartilage for maybe a cadaver or that microfracturing? And if not, what sort of therapy should I start investing in now to save whatever I have in my leg? Because it doesn't pain me to the point where I need a knee replacement, but I haven't had cartilage in my leg for at least 10 years now.
All right, sounds like a question for the doctor.
Yeah. Well, I guess first off, it depends on how widespread that cartilage loss is. You talked about the microfracture, or we call an abrasion chondroplasty. Those are, if you want to think of it in layman's terms, that's like sort of filling a pothole. But it can only be so big an area. If that area of cartilage loss becomes too large, then if you try and do that simple microfracture or abrasion, then you're actually going to be causing more problems, not only there, but the bone underneath of it's going to get irritated. There's other options there, such as a carticel procedure, where we will harvest some cells from the bone, cultivate it, then inject it in there through a second procedure, or even do a cartilage replacement from a cadaver, which you basically core out a plug encompassing and involving the entire area of cartilage loss, take that part out of your knee, and then have an identical drill from an identical area drilled from the cadaver knee, and then you replace it back into yours. Again, it's a radical procedure. I don't know how old you are, but those are kind of that's really your only other options in terms of a cartilage replacement procedure.
All right. Thank you for the phone call, Wes. Our toll-free number, 1-888-634-7488. All right. Let's go to Westchester. I understand we have Cheryl on the line. Cheryl, welcome to Sports Doctor. What's your question for us tonight?
Well, thank you. I was listening to your discussion about how swimming was so good for you, and it's funny that you said that because I am a road runner and I am a bicyclist. I had a knee replacement or an ACL replacement in '96 from karate. And swimming, I find to be the hardest, most uncomfortable sport for me. So I was kind of curious why you think that might be.
All right, Dave, you want to get that?
Sure. What kind of a swimming are you doing? Are you doing a flutter kick by any chance? The flutter kick, correct?
Laps?
Laps.
Freestyle.
Freestyle. Okay. Yeah. Well, what I've found a lot of times, especially with ACL injuries, the flutter kick has a tendency to put a lot of stress on the ACL, especially early on, and it really creates a little bit more inflammation. And you really need to do more deep end stuff as far as deep end running, where you're really not having the contact. If you have deep end, it really builds up your cardiovascular. Hopefully that's the reason why you're trying to get in there. Do deep end running, where it really not going to create any problems on an ACL by doing it that way. But the flutter kick has a tendency to create a lot more stress to be applied because it's quick and short motions. So try to avoid that and do a little more up and down motion.
All right, Cheryl, thank you for the phone call. Our toll-free number is 1-888-634-7488. It's Sports Doctor. We're talking knee injuries. We've got Butch on the line from Glassboro. Butch, welcome to Sports Doctor. What's your question for us tonight?
Well, I was supposed to get my knees done about 4 years ago, and I didn't do it. Rotman Institute said I needed to get them replaced, but then I'm a barber in Glassboro, and I'm trying to get, they said there's a new method of fixing the knee, and I was wondering if it was possible to get that done now. I'm 64 and a half.
64 and a half, and you're a barber, and you need both knees replaced, if I understand correctly, but there is some sort of new procedure. Do you have any idea what he's talking about?
No, I really, you got to give me more to go on than that.
Did you know the name of the procedure by any chance?
No, I just heard it on one of the medical shows the other night. Instead of replacing the whole knee, there's a new procedure that they only replace like a part of it.
The partial knee
part of it.
Okay.
Well, replacing part of it's really not new. I mean, it's been around for probably 20-some years. It kind of fell out of vogue, then it came back into vogue with new technologies. But yeah, you can do a partial knee replacement, and I mean, if you fall into the criteria for that, not everybody does. And you know, the guys at the Rothman know what they're doing. That's all they do. That's all they know how to do is knees. So they're very tunnel visioned with that. So if you, once they've diagnosed that, you know, you can fall into the criteria of a partial replacement rather than a total, I'd say go for it. But as long as the rest of your knee's fine, it'll be less pain, it'll be less rehab, you basically get back to your normal activities better. It does set you up for sometime in the future needing a revision to a total knee replacement. They can last, depending on someone's activity, anywhere between 7 and 11 years, roughly. It depends on the technique putting it in, what kind of activity you do, how you heal from it. A whole lot of factors get put into the equation for that. But a partial knee replacement is a good option if you have enough good cartilage left in your knee that you don't have to cut it out.
All right, Butch, thank you for the phone call. Good luck with that. Our toll-free number is 1-888-634-7488. They're telling me we need to take a break. Let me tell you about our sponsor, which is Cross Keys Physical Therapy Sports Medicine Center. All these locations, Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, Swedesboro. The phone number's next to them. If you want to take advantage of the free screening offer, just call to make an appointment, choose the center closest to you, and take advantage of that. We are talking knee injuries. We're taking your phone calls. Our toll-free number is 1-888-634-7488. More of your phone calls when we come back right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
I will be.
I will be. I will be.
I will be a pro.
A professional athlete.
A gold medalist.
If you want to be a pro, then train like a pro. Hi, I'm Mike Quick, and I've joined the Velocity Sports Performance Team powered by the Rothman Institute. The highest levels of competition require more power, more speed, more agility. Here at Velocity, we train athletes of all ages and skill levels in these specific areas. Come in for a free training session and see how you can maximize your potential.
Thank you for joining us. This is Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, Vineland, Pennsville, Swedesboro. Our toll-free number is 1-888-634-7488. Tonight we're discussing knee problems. If you have a question about a knee problem you're having, please call us. We'd love to hear from you. Answering your calls, Dr. Anthony Valarie. He is a board-certified orthopedic surgeon. He is with Tri-County Orthopedics. Next to him is Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. On the line, let's go to Yardley, Pennsylvania. I believe we have Sandra on the line. Sandra, go right ahead with your question on Sports Doctor.
Well, the question is not concerning my knee, it's concerning my hip.
Okay, can we do that? Yeah, go ahead.
Can you do that?
Sure, go ahead.
Okay. My hip hurts really, can you hear me?
Yes, go ahead.
It hurts really, really bad. It feels like the hip is out of socket, and I can't sleep at night, and when I walk, it hurts. It's really, really bad. It's like from the hip all the way down to my leg.
Okay. How old are you, Sandra?
55.
Well, obviously, you need to be evaluated. I mean, that's the first thing you need to do. I mean, it's really hard for us to analyze over the phone lines here of what's really going on with your hip. You really need to get evaluated by an orthopedic surgeon like Dr. Valarie here, who really can tell you what's going on with your hip and really feel and find out what's going on and send you for tests and so on and so forth. And he'll follow up with that.
Yeah, so many people come to me and they think it's their hip. You know, you walk in the room and say, my hip hurts. And then I ask them the point where it hurts. And they'll point to their butt or they'll point to the side of their hip or it's just somewhere. And areas that I know through doing this all these years, I just say, well, that's not your hip. It's probably tight muscles. It could be a tight iliotibial band. It could be your gluteal muscles. It could be coming from your back. If it's groin pain, well, you know, it could be a groin pull. But if you have true groin pain, then I start to think this is your hip joint. First thing you need to do is get an x-ray. Absolutely without an x-ray. It's like a cardiologist needs an EKG. An orthopedist needs an x-ray. And then we just take it from there, go through the exam like Dave was saying. And I guess the most important thing is where's the location of the pain and just develop a pattern from it. Put that together with the x-rays and you can come up with a treatment plan for it.
All right, Sandra, you need to have that looked at. I hope you do. Our toll-free number is 1-888-634-7488. I believe James, is that his name, from Philadelphia? Yes, James,